So anyway, we just went on to talk about some of the barriers. This is they want another siloed. I don't know how you spell siloed, but PowerPoint doesn't like the spelling it that way. But it had no suggestions for me about, you know, the comments of siloed. You know, here's your cardiac product, here's your kidney product, here's your depression product, and employers don't want another silo. They want something that's integrated, that's pulled together. People generally don't recognize the importance of primary care, even though we've known this for years and years and years. In general, employers don't realize. They think specialty care for somebody who has a mental health problem. And we talk a lot about the organizational arrangements with the small group practices. There are clinical and treatment barriers. There's really been no new clinical treatment breakthroughs since 2006, just variations of existing options. So there's not been any new, maybe some of the online stuff, like the online CBT, might prove to be a breakthrough, but we've not had, in terms of new medications, there's really not been anything new. There's always hope, although there's concern that there's not much in the pipeline now with regard to behavioral health conditions. The employers carve out, this kind of gets into the financing thing, carve out their mental health benefit. So even Optum, which is owned by United Health Group, is a carve-out company that manages behavioral health, sometimes for United Health, sometimes for other health insurance companies. So it's been a common organizational arrangement to carve out mental health benefits and treat them separately from general health benefits, and actually have a whole different company deliver them. And that just makes it harder to integrate because they're not working out the same medical record. There's like a medical record for the behavioral health and a medical record for general health, and that makes things difficult. And the last one is redundant from what we said earlier. So this is the call to action. There's obviously increased opportunities for improvement. You know, we now know that 75% of all healthcare expenditures, which is like now it's something like $2.3 trillion a year, so a lot of money is spent on the treatment of chronic illnesses, and we do a terrible job in terms of treating chronic illnesses. And this, as I argued earlier, this care management, coordinated care approach, I think is going to be a good generic approach to the management of chronic illnesses, and I think people who have special preparation in the behavioral health areas offer a lot to those treatment options. And it's interesting, there's a group called the Partnership to Fight Chronic Disease, which has been working since 2009, before the Affordable Care Act. And we finally had gotten their attention, I think, about the importance of mental illnesses. When they started, it was a real struggle. I think because they didn't want, I think it was the same old stigma thing, you know? They wanted to talk about heart disease and diabetes and obesity, and they didn't want to talk about mental illnesses, because that has changed. We beat on them quite a bit, and they've changed. And I noticed this at the Carter Center Symposium this year. Ken Thorpe, who's the Emory University, who's been leading this effort, is going to be one of the featured speakers, which I thought was terrific. So they've kind of gotten that that's important. There's a lot in the Affordable Care Act. There's an awful lot of focus on person-centered care. And remember, we showed that collaborative care model earlier. The patient, the person, was in the center, and you organize services around that person rather than having them have to go to all these different places to get their care. There's a lot of rhetoric there. There's some financing mechanisms that are being proposed. Let's hope, because everybody kind of realizes what we have to do, and people keep struggling with the stuff we've been talking about here, about how you get there. And there's stuff in the Affordable Care Act that we hope is going to start to deal with some of these issues. We talked about the fact that the expansion of health insurance is huge, and there are many preventive services in healthcare reform that have to be offered for free. And so, if you could start to do the depression screening, for example, and have that be a mandatory benefit that was required to be part of an insurance package with no copays. If you eliminate copays, that eliminates one of the barriers for people doing things, right? If you've got to come up with $20 to go see your doctor, but if you can go and get your flu shot, my wife is old enough to be a Medicare recipient, and she always holds over me since I'm still a few years from that threshold. the fact that she can get her flu shot for free. You know what I mean? So if you make it easy and free for people to get the preventative stuff that they need, and there's in the Affordable Care Act that does that. And we talked a little bit about accountable care organizations, which are the great line about those. That's a new concept in healthcare delivery where you have an organization that oftentimes is hospital-based that's responsible for the health status of a population. So it's not, the idea is really establishing kind of a public health entity that's responsible for how well everybody is doing, and you monitor the